Hey guys, welcome back to my channel, The ENT Resident. Today I'll be addressing a Viva question that we face commonly if you get a long case in ear. And the question is, what are the differences between mastoiditis and furunculosis? Now I'll be discussing all of those. If you want to purchase my notes now, I have added links in the description. Okay, so let's get started. Now, mastoiditis. Usually, in mastoiditis, we see a preceding history of acute otitis media or chronic suppurative otitis media. Whereas in furunculosis, we'll have a preceding history where the patient will probably tell you that they have tried to self clean their ear. Probably they have used a earbud to poke around in the ear and clean it. So there will be a history of self cleaning of ear. Second point, coming to ear discharge. Now, in mastoiditis, the ear discharge is always mucoid or mucopurulent. You'll notice how a mucoid component is definitely a part of it. Whereas in furunculosis, it is always, if there is a discharge, it is always purulent discharge mixed with a little bit of blood. But never at any cost will there be a mucoid type of discharge. Why is this important? Now, the mucoid discharge that you see in mastoiditis is due to the presence of goblet cells in the middle ear. Now, these goblet cells or mucus secreting cells are not present in the external auditory canal. Now, furunculosis is a situation where it is involving the external auditory canal. It is not involving the middle ear. That is why you'll never see a mucoid or mucopurulent discharge in case of furunculosis. So, this is a very defining feature to differentiate between both these diseases. Next, coming to the position of pinna. In mastoiditis, the pinna is pushed outwards and downwards. Whereas in furunculosis, pinna is pushed outwards and laterally. Next, in post-auricular groove, this is a very important difference. The post-auricular groove gets obliterated in mastoiditis and this is preserved in case of furunculosis. Sometimes it can even get accentuated in furunculosis. Next point is tenderness. Now, where will you find tenderness in case of mastoiditis? You'll find tenderness over the mastoid process and the cymba concha. Now, this cymba concha is basically a landmark for the suprameatal triangle or the McEwen's triangle, which lies underneath it. And suprameatal triangle is basically a landmark for finding the mastoid antrum, which lies 1.5 centimeter deep to it. So that's why you'll get tenderness over here in case of mastoiditis. Whereas in furunculosis, there is a typical clinical examination sign, then that is tracheal tenderness or tracheal sign positive that you see. So on pressing the tragus, the patient will wince in pain, and that is known as tracheal tenderness. Next, moving on to the point of external auditory canal. Now, in mastoiditis, we see a posterior superior canal wall sagging, whereas in furunculosis, we see a red and tender furuncle in the external auditory canal. Next point is the tympanic membrane. Now, in mastoiditis, the tympanic membrane is definitely involved. It can either be inflamed, perforated, or even bulging to the point of bursting. Whereas in furunculosis, the tympanic membrane is most likely to be normal because this is a condition that involves the external auditory meatus. Next, coming to mastoid. Mastoid in mastoiditis will have this typical appearance which is known as ironed out mastoid. What does this mean? So, when you try to touch your own mastoid, if you try to palpate it, you'll see that it feels a little rough and bumpy. There are these ridges on the mastoid. But in case of mastoiditis, what happens is we see inflammation of the underlying periosteum. That leads to the smooth, ironed out feel of the mastoid as if there are no ridges present over there. That appearance is known as the ironed out mastoid. Mastoid is normal in furunculosis. Next is hearing loss. We see a conductive hearing loss definitely in mastoiditis, whereas mostly there is no hearing loss in furunculosis, or if it is indeed present, you'll see a mild conductive hearing loss. Fever and systemic signs are more of a feature of mastoiditis rather than furunculosis. And pre and post auricular lymph nodes, these can be present and tender in case of mastoiditis and absent in case of furunculosis. So these are all the differences between mastoiditis and furunculosis. And let's look at these few pictures over here, things that I've already mentioned. The first image over here is the ironed out mastoid. You can see how smooth this feels. And you can also see that the pinna has been pushed downwards and outwards in this case. And the retroauricular groove has been obliterated over here. So this is a typical image of acute mastoiditis. The second image over here is showing the yellow arrow that you're seeing, that is showing the posterior superior wall, canal wall sagging that we see. And last image is that of a furuncle. You can see this is the furuncle over here. We see a red tender furuncle in the external auditory canal, but the tympanic membrane is not involved over here. So this was about the differences between mastoiditis and furunculosis. If you have any other questions, please note them down in the comment section and I'll get back to you. Thank you.